Hey guys, welcome to Dubai Pain Free. I'm your host, Ryan Davis, a sports chiropractor and performance rehab specialist based here in Dubai, and also the founder of a company called WODMedic. So today what we're going to be talking about is 4 keys to properly managing the injured CrossFit athlete. So CrossFit gets a bad rap, a very undeserved bad rap, as a mode of fitness that's likely to create injury. They just released a study actually this week showing that CrossFit has no more of an injury risk than any other traditional form of fitness. And in reality, if we're really pursuing fitness, you can expect some aches and pains along the way, but we just want to make sure we're managing those things correctly. And each sport kind of takes a certain nuance to how we go about treating that type of athlete. And today we're going to talk about how to do that in terms of a CrossFit athlete. Number 1, so 4 keys to treating CrossFit injuries is we want to start some treatment for pain management. So these are what we traditionally think of as our hands-on treatments, our dry needling, manual therapy, chiropractic adjustments, depending on the actual tissue involved in the injury, the nature of the pain. We want to find a way to kind of get control of the pain, desensitize that injured tissue. So that's step 1. Second, we want to lateralize the painful movement. We don't want to completely rest. So if we're taking something like shoulder pain where it hurts only to press overhead or to do a pull-up in the overhead position, maybe we'll lateralize that painful movement, still put some load and some stress through that joint, but in a way that doesn't aggravate things. So we want to lateralize so we don't lose physiology. Lateralizing meaning we're not taking a step back. We're not really going to be making progress forward. We're going to take a side step and continue to try to at least maintain a similar level of physiological adaptation to that area as we had before the injury. So we're not losing too much as we try to heal up and get out of pain. Third, we want to improve the movement if it was creating overload. So let's take a shoulder. Maybe in the overhead press or overhead scenario, the athlete's lacking full shoulder flexion or full thoracic extension, and this is creating a stress concentration in that rotator cuff and creating an overload scenario faster than maybe it would had they had better biomechanics. So this does exist. So if the movement itself is a source of overload, then we want to try to regress some aspects of that movement and try to improve that movement during the rehab process. So maybe when they're out of pain and they go back to that movement that created the injury, they can now do it in a way that has less of a stress concentration to the tissue that was overloaded in the beginning. Last, then we want to design a proper progression back to normal. So we don't want to step way back right after the injury. We're fighting to maintain a similar kind of fitness level during the injury process. And then we want to design a proper progression back to normal that's based on kind of the hierarchy of stress or load so that we take the athlete back through the correct phases and then return them back to their normal level of fitness and to their normal volume of fitness and activity. So those are 4 keys to treating CrossFit injuries. Like always, if you have questions or there's a subject matter that you'd like us to cover here on Dubai Pain Free, send us a message at ryan@dubaipainfree.com. Thanks.